So with no further ado, welcome this morning, and I hope you have a very inspiring, mindful, and enlightening morning. Thank you. Thank you, Peter.
Thanks. Thanks very much, Diego, and also thanks to Ola and the organizers for allowing me to represent the Swedish Society of Medicine here today. This is a great honor and privilege. Thanks very much for that. And I would like to try to convey the picture of the global situation of the world regarding health. It's not an easy task. It's a very various world, as you know, and the countries face different problems around the world. But I will just try to show a slight window to you. The organization that I represent is an old organization. It was founded in 1808 in Stockholm, and then it grew, so it's now all over Sweden. And the focus that we are doing is to stimulate and encourage medical research. So we spent a lot of money to projects to young investigators in Sweden. We also focus on physicians' education, students and physicians' education, and of course it's very important with ethics and the quality of medical health care. The recent years we have a particular focus on public health because there's been a lot of focus over the years of patients, but you have to also focus for the society and to try to prevent patients from being patients. And that means that you actually start from the day you are born and onwards. And that means a lot of a lifestyle focus and research, and that's what we've been particularly interested in. And this is also the work I will present to you. It's also a focus that we have on global health matters. So this is shortly about the organization. So of course, I mean, everyone is interested, and Ola was saying also that what kind of world do you actually want to live in, and what kind of future do we have, and what does the world look like, and how can we in the affluent part of the world help other parts of the world as well, because we're all part of the same planet. So to start with, I will show you some figures from the Health Metrics Institute in Seattle, in Washington, in the US, and I will switch over here to the internet and see how that works. And please bear with me, and we'll see if this can. Well, I hope the internet is fast enough, but it's a the change of scales is always a hassle, isn't it? Anyway, this is we'll put it this way. This is not the numbers, but it's actually online, so you can change whatever you like. It's a brilliant work by Chris Murray and Dr. Lopez in Seattle, and it's also based on the publication in The Lancet in December 2012. It's a triple issue of The Lancet, which is a fabulous issue trying to get together what the world looks like in figures and graphs. And it's also interactive. Here you can show the causes of disability. I put it here in disability-adjusted life years. And you can then put in males or females and ages and various countries or regions in the world. To start with, you can see that if you put here, for example, where we are now in Western Europe, it takes a little bit time to change all this, but if you click the Western Europe, all the schedule will change, and you can see what kind of causes disability around the world for the different topics here. And we can see that we are living in a world, and this is a global now, we are living in a world with a lot of cardiac problems, and it's almost number one and number two across all the world, except, of course, as yet in sub-Saharan Africa. And we have a major problem that we have to deal with here. Therefore, I think it's so vital to put emphasis on the public health, because it's the only way you can manage these huge problems. Because it's not only the developed world that is facing this problem, it's most countries. And disability is also actually number 2, is low back pain, which causes problems for people. And as you can see here, for the Western, this is the Western Europe now, major depressive disorders and psychological ill health is high up on the scale. So you can see that it's mostly among the 5, 6 that causes most problems for people in the Western Europe. And it's about the same thing if you go to the high-income North America. It resembles quite a lot than the situation in Europe. Isn't it beautiful that you can do this online? Isn't it nice, isn't it? It's great. And you can go around and fiddle around with the data to understand it. It's some kind of presentation with the Gapminder that Professor Hans Rosling usually is doing. So I think it's brilliant. North America suffers also as you all know, the cardiovascular problems, and also lung infections and pulmonary diseases, much from smoking. You see, I mean, so simple thing at just stop smoking. Easy. You know what to be done, but how to do it. Major depressive disorders is also high up on the scale. However, though, if we go down here to sub-Saharan Africa, you will face completely different problems. As you all know, this is not a rocket science situation. We know this, but what do we do about it? Okay. What is the number 1 here? Well, you have HIV/AIDS, of course, and you have also the respiratory infections and diarrhea, tuberculosis, malaria. Completely different. However, though, also these countries are beginning to suffer from cardiovascular disease. So this is just a brief picture of what it looked like. Another variant you can use is to, from the same group in Seattle, is to see what is the differences between 1990 and 2010. And this is also the good news in a way, because the difference and the development from only 1990 to 2010, 20 years, has a remarkable, incredible progress in the world. For example, the poverty, the extreme poverty, has decreased from 40% to 20%. That's halved during this time, according to the World Bank. And the World Bank just recently announced that we are now fighting the rest of the extreme poverty during the next coming 30 years. And with particularly focus then on India, which is one of the poorest countries in the world. And it's also the division within the country, which is enormous. And also it's expected that up to 2050, India will have the most populated country in the world and will pass China. Anyway, so what does this tell you then? Well, we have the developed regions here now with the disability and causes. Still, from the 1990 to 2010 is the ischemic heart disease, cardiovascular disease, and stroke, which is the a major killer. So if we then go to risks, and look at this, fantastic, it's great, it's wonderful, and you can turn around in your own way, in your own room, and you see that, well, what we put in our mouth daily is one of the risks that lead to these kind of events that I was talking about, this ischemic heart disease and so on. So the lack, according to the Lancet paper, the lack of fruit intake, vegetables and so on, are very, very high up on the causing problems. And then you have high blood pressure. And why is it that so many of us in the developed countries have high blood pressure? Well, maybe that the society is not mindful enough. Could be. So we have to figure this is the perspective that we can actually try to use mindfulness in a way that helps a lot, as one perspective of it. And then you have third, smoking. Haven't we learned anything on these 20 years? Well, some have, but not all. If we then switch this to developing countries, Now it will change again. Look. It's amazing, isn't it? It's truly amazing. A lot of work behind this. So we can see also that the progress is that the developing countries has reduced their problems with the undernutrition, with malaria, with HIV/AIDS. That has decreased substantially over these years. And what happens instead? Well, the dietary risk here, as I showed here, in this developing world has gone up to the number 1. And they have a double problem. Although the world is getting the longevity and the life expectancy is increased, we are not healthier in a way, but we live longer. Something to consider. And look at here, smoking goes up. High blood pressure goes up to number 2 in the developing countries. Makes you think, right? So this was for the internet. So the health metrics evaluation, I strongly recommend that. So I would like then to turn back to the PowerPoint and see if we can succeed with that. So what is the world we would like to face and to be in? Well, the society is interested in these questions, and we organized a conference in Stockholm just a few months ago, an international conference that we did together with the Lancet and the Royal Swedish Academy of Sciences and the Engineering Sciences, and invited a lot of people to have this public meeting about what is happening now and how do we get further on with the world. And one of the moderators was Richard Horton, who is the chief editor of the Lancet, and he had a brilliant grasp of these speakers and the people. And it was the audience was invited with Twitter and Facebook and everything. So we get the people's idea. What do they think about the world? And that resulted in a declaration. We called it the Stockholm Declaration of Global Health. We said a lot of text here, but it was published just a week ago, because it's about to promote the social justice globally and to safeguard the well-being of current and future generation. So this is the fundamental thing. And the fundamental thing is also that we have not just to engage universities and students and so on. We have to start in school in the very first time. And I was very happy when you said that, Ola, next year we'll also be invited program for children. That is perfect. You have to start early. There is also a copy of the declaration will be found here as well, so you can read it more thoroughly through, should you like. And we focus then on a few points. And the first point is, you have to link the ongoing agendas with the new agendas. You can't lose the MDGs because they are, so to speak, in a way, finished at 2015. But of course, it's an ongoing process, and you have to tie it up to the new agenda. And the new agenda is more with the cardiovascular disease, the hypertension, and all the lifestyle diseases affecting also the developing world. So you have to link that together, which is not an easy task. But it's a lot of discussions going on around the world, with a lot of consultations across the world to try to finalize how this is going to be post-2015. So, because you can't forget about the HIV, tuberculosis, and malaria, and diarrhea, and those problems. You have to face that too, because it's a major, major problem. Maternal health, children health as well. Another step is then also to creating stronger leadership and accountability. And accountability is vital to really push the countries and their governments to do more. But you have to put health in the center. And what do you do to improve health in order to help others? That's what Ola was talking about as well. Building capacity and investing in health matters. You have to invest then in the leadership for the global health through education. And I like this, from primary school to the university, and of course onwards in life. You always learn. As Winston Churchill said, I don't like to be taught, I like to learn. And we talk too much about teaching. We should talk more about learning, I think. Public empowerment. To bring these matters up on the agenda for the public is important. So it's not just a group of specialists in global health research, for example, but you have to involve the public. Exploiting opportunity and synergies is quite obvious, isn't it? But you have to take care of that you don't increase the gaps in the society, but to minimize the gaps in the health agenda. And we have to consider the maternal health, the child health, which is still a great, great problem in the world. We have to look at that much more strongly. And also the mental health, the violence in countries, violence against women, for example. We had to do more. We have the climate change, which affects health. Usually, people are talking about climate change, and it's the Arctic is melting. But what does that affect health? What happens with health matters? So climate and health have to be discussed, linked together. So the group that helped us with this is this fabulous group up in University of Umeå, with Stig Wall, Julia Blomstedt, and Peter Byers, with the specific expertise, Robert Beaglehole and Ruth Bonita from University of Auckland in New Zealand. And also together with Richard Horton from the Lancet, who has put this work together, both before the meeting and the declaration. So how do we continue, though? I mean, health is, of course, going to be a goal in itself. And the health of people has to be the driver. But then we have to figure out the mechanism how we do this. But we have to consider health when we talk about sustainable development goals that are coming now, that are developing, and which will replace the Millennium Goals. And we have, although these diseases has to be addressed, of course, the concept then of the holistic person's health is incredibly important, and the well-being. And that must be in this framework of Sustainable Development Goals, which is the SDGs. You have to have this holistic picture, otherwise we are lost. And of course, the health goals should be universal. We have to look at the different needs for the different and various countries. And particularly the responsibility for the affluent countries to share with them. Because we have to beware of and work of the principles of equity and for the human rights. So special attention also to, when we talk about health, is to for the aging population, because the population is aging, and we are facing, as Ola also said, that many of the coming generation will be 100 years old. You can have a lot of meetings here in Tällberg the older we get, is that right? So we then need to sustain our lives in a good health and well-being, and not just live with too many of the diseases affecting us. But also, we have to start from the beginning. You have to consider more thoroughly on the young generation. So I will conclude with saying that this is just a few frames or pictures from the meeting we had in Stockholm. But it's amazing to see that Sweden, over the 20 years, has increased the life expectancy with 7 years, which I thought was, sorry, it was from 1970 to 2010, so it's 40 years. So 7 years and 40 years, which I thought was amazing when I read those figures. In Bolivia, for example, the life expectancy increased over these 40 years with 20 years. 20 years increase in life expectancy. So there is enormous progress going on, and we should embrace that. But we can't be still with it. We have to keep fighting the inequalities of health and the maternal and child health to improve that in the future. So I think that the global health is something that really, really, really affects us all. Thanks very much.